Welcome to the Daily Dose of Derm podcast, your go-to podcast for all things dermatology. I'm Dr. Mohiba Tareen, a board-certified dermatologist and the founder of Tareen Dermatology. Join us as we dive into the fascinating world of skincare, beauty, dermatologic treatment, and how to enter the world of derm. Whether you're a skincare enthusiast or an aspiring medical professional, this podcast is your daily dose of knowledge and inspiration. Get ready to uncover the secrets to healthy skin and discover how to make a meaningful impact in the field.
Hello, welcome back everyone to another episode of the Daily Dose of Derm. I am your host, Shiab Adam. We are continuing our cosmetics segment. Today's episode is the ultimate guide to cosmetic injectables. Today I'm with here Sima Bazooband. She is the Associate Director of Aesthetics here at Tareen Dermatology. She is incredible, she is knowledgeable, and she has every single ounce of knowledge on cosmetics. Sima, thank you so much for being here today.
That was very kind of you.
Yes, absolutely, absolutely. So just take us a little detour into your background. What brought you into this field, essentially? Take me there.
Yeah, absolutely. This was not really a field that I thought that I would end up in, honestly. I've always enjoyed aesthetics, whether it be makeup or healthcare or aesthetics aspects of those fields. And I went to school at the University of Minnesota and I went for biology and neuroscience.
Nice.
And initially I worked at a company called Be The Match, which is not a dating website. A lot of people think that it is. It is not a dating
Be The
website.
Match, elaborate, please.
They're a wonderful, wonderful company. And I had thought about pursuing my MD or my PA or my NP. I know so many wonderful healthcare professionals, obviously those here at Tareen Dermatology included. And through a friend, Tori Crest, who was actually on this podcast.
Yes,
Tori,
I remember
so
Tori.
Yes.
Yeah, she was awesome.
Through Tori, I got my job here, and I've now been here for 6 years.
Wow.
And, I think after a couple years of working with Dr. Tareen, I had decided maybe that being an actual provider was not for me. I was more interested in sort of the business applications. And as silly as it sounds, I didn't want to be restricted to seeing patients, which I know there's so much variability in what that day looks like, but I really wanted my hands in all the pots.
Sure, yeah.
And it was actually Dr. Tareen and her husband Bazer who approached me with the idea of moving into the aesthetics field because they had seen my interest. And that's the story. That's how I got here. And that's all she wrote because after I made that transition, I just haven't left. And I've been here now on the aesthetic side for 4 years. Yeah. And I think that there's just so much within this field. And I do love personally, at least with aesthetics in this field, that it kind of bridges science and aesthetics, right? Because you are working with injectable treatments. I don't want to say not just, right? But not just facial treatments. And so for me, it sort of has this harmonious blend of the science background that I come with and my desire to be involved in the healthcare field while being somewhat removed and having that sort of personal interest of aesthetics.
Yeah, absolutely. So what did your training have to kind of branch out into in terms of specificity? What did your training regimen really consist of once you really stepped foot into just being
in aesthetics? And I think it was a lot of working hands-on with Dr. Tareen, of course. Heading to different dermatology conferences as well, and really diving in with the individual companies to become more of an expert on the products themselves. And we'll kind of touch on this in a bit, but there's just so much in this industry to learn, and it is ever changing, right? So a lot of it had to do with being in the field itself and then seeking out additional research. So, you spoke with Rachel last week, who's our amazing esthetician, and she went to aesthetic school. And because I'm focused more on the business side of things, I did not go to aesthetic school. So there's numerous paths to get here, truthfully, if anybody's looking into that. You could have a medical background, you could have a business background, you could have a marketing background even, but a lot of it has to do with your drive and your experience to be in this industry.
Amazing. Oh, that's amazing. So kind of going into what we offer, just like in any clinic, our clinic specifically, there are so many different types of injectables. Dr. Treen's always quizzing me on, but help me out here, right? We have Botox, right? We have, along with with that. We have the derivative Dysport.
Yes.
We've got filler. What am I missing? Help me out.
Yes. Okay.
Like there's
so the
many.
there's so many actually, and I was thinking about this question before I came on. I'm like, how do I categorize all these things? So I did do a little categorizing. So you have what I'm going to call neurotoxin. You have fillers, and then you have what I would categorize as biostimulatory injections, and then targeted injections. And these are some of these are category names that I just made up.
Yeah,
So,
I love it. No, they sounded great.
Yes. So for neurotoxin, the most common neurotoxin that you might hear is Botox. Another one could be Xeomin. It's Daxxify. It's Dysport. So Botox is kind of like Kleenex versus facial tissue. You can think of neurotoxin. And what that is it's botulinum toxin A. And it essentially stops the muscles from contracting. So a lot of people come in and they say, you know, I look angry all the time. I've got these 11 lines. And over time, as you squeeze your muscles, you know, whether you're focusing, whether you're actually angry, you know, whether that's just a face you make, whether you have RBF like me, whatever it is, right? You know, you start to squeeze, and over time it creases the skin and it creates the line in the skin. So what neurotoxin does, again, that's Botox, that's Daxxify, that's Dysport, is it stops that muscle contraction. And scientifically speaking, what it's doing is it is blocking the acetylcholine, or the neurotransmitter, from getting to the muscle. And that's what stops that muscle contraction. Just like you contract your bicep when you lift a weight, or, you know, when you pick something up, that's a muscle contraction. So we're not putting Botox in your bicep, right?
Right.
But what we can do is use it in targeted quantities to stop those lines from getting worse. That's our neurotoxin category. Okay, that's your Brotox.
Nice.
Yes.
Oh man.
And then we have fillers. So the way that I like to think about fillers is fillers fill. Okay, that's like the blanket way to do it. There are multiple brands of that as well. You know, even if you look internationally, some brands are in the UK that are not in the United States. But, you know, when you think of Juvederm, when you think of Restylane, when you think of Bellatero, there are so many different kinds. RHA, there's a lot of different kinds of filler. And within filler, it's this big umbrella of types of filler as well.
Yeah,
so yes, you can have hyaluronic acid fillers, which are using a component of your skin called hyaluronic acid. You might hear that sort of buzzword in skincare as well, in a gel formulation that's then injected. There are also calcium hydroxyapatite fillers, which are a building block of bone. So within fillers, there's a big umbrella of brands and types as well.
Are there certain brands or types that are better for a certain candidate, or a certain like groups of people, whether it be, you know, older individuals, younger individuals? Like, are there certain ones that are actually recommended for those types of things?
That's a great question. So with fillers, generally speaking, when you're talking about brands, a lot of that is provider preference, right? Like when you go to the store, are you buying Chex Mix, or are you buying, what's the other one? Gardettos, or are you buying Gardettos? right? Which one do you like better, right? Which one tastes better to you? Obviously, we're not tasting filler, but it's kind of that same theory is, what do they like injecting? What do they see the best results for with their specific injectable aesthetic style? And you know, we can talk about providers too. Everybody's got a little bit of different flavor as an injector. But with regards to your original question of which brands, which types, each line individually too will have different types within it. So for example, if we're talking about the filler Restylane, which we use fairly often here at Tureen Dermatology, they have, you know, a filler called Lift, and it's a little bit stiffer and it's meant to mimic bone. You don't want something that tough in your lips, right? Otherwise, they are going to be extremely obvious. They're not going to move. Your cheekbones and your lips express very differently on your face when you're smiling, when you're laughing, when you're eating, when you're talking. So putting different materials in different parts of your face naturally makes sense. Same thing with age, right? Someone who's a little bit older might have a little bit more bone resorption. They might have a little bit more fat pad loss. They might have a little bit more skin laxity. And so we might find we need either a higher volume of product or a stiffer product, or both, really. So I would say, generally speaking, the short answer is yes. And the long answer is it depends.
Yeah, for sure. If someone were to just come in to, you know, say they're interested in getting filler for their lips, it was something they really wanted to just really enhance in regards to their physical appearance, what is something that they could expect? Just as an example, just a regular filler appointment. what would they expect? Post-care wise,
yeah.
what would they expect? Immediate results? Would it take some time? What does that timeline really look like?
Yeah, that's a great question. So typically, your provider should do a consultation, right? Whether that's your provider, your provider's associate, whoever you are going to see should provide a consultation. Expectations and goals are so key when you are talking to someone. And it is very important to be clear about those goals and expectations, both on your end and for your provider to do the same, right? This is your face. You know,
Right.
I
You
feel
can't
like we
mess
say this
around.
all the time.
Right.
Don't budget your face, right? This is something, and you know, to a certain extent, some products are reversible, which is great, but a consultation is a really important process in choosing your injector and making sure you're on the same page. And so I do recommend that if you are seeking an injectable treatment, to make sure you have a consultation first. And most offices, ours included, do require that prior, right?
For sure, yeah.
And then once you've had that consultation, you come in. And in terms of our office, we kind of reconsult the day of treatment too. We just say, okay, reminder, these are our goals. This is what we're looking for. Then we'll have a discussion about products and budget, right? Because everybody's a little bit different with what they're looking for, what we need to use to get there, and also what fits within their budget.
Yeah, for sure.
Once we agree on that treatment plan, we might use some topical numbing or anesthetic. We use an ice roller. There's a lot of tools we use to make the procedure more comfortable. The good news, and some people think about this too, and I think this speaks to how important it is to get this knowledge out there. You're not put under for anything, right? This is this. You go home. You can drive home. You're just fine. So we do create a more comfortable experience. And then in terms of the actual filler injections themselves, of course, they are used with a needle. Some providers use something called a cannula, which is in and of itself just a slightly different variation on a needle. But the injections take place. Most often there is numbing in the filler as well. So you will find, hopefully, as the injections progress, that, you know, when we inject in the same area, it's more comfortable, right? Because you've got numbing both topically and in the skin themselves.
Sure. Absolutely.
And then once the injections are complete, some providers like to massage and mold it just a little bit to make sure that everything is exactly as it should be. And after that fact, it's really about post-care. So you can expect swelling, bruising, you know, inflammation for up to 2, even 3 weeks as the product starts to settle into the skin. Now, it's also important to have an open communication with your provider, right? Because things can go wrong. And if you listen to any injectable discussion, it's not if, but when. And so you really want to make sure that you vet your injector.
Yeah, absolutely.
Right? So when you're having that consultative process, look at your injector. Do you like the way that they look? And not in an aspect of, you know, attractiveness, but in an aspect of, if this person's injecting you, they probably have injectables, right? So does this person look or have an aesthetic that you appreciate? What is this person's background, right? Are they a medical provider? Could they assist you if there is indeed a complication? Can they prescribe you medications? Can this person really give you what you're looking for? Because with filler, there are high risks, right? You know, if you are perhaps looking for someone who matches your budget, make sure you plan ahead. Make sure you do your research, because the last thing you want is to have a complication because you went for a cheaper option. It could cost you in the long run, you know, and I don't want to judge anyone for making choices that feel right or authentic to themselves, but this is an important thing to talk about. Because the biggest risk with filler is something called vascular occlusion, where the filler actually blocks the blood vessel and can cause tissue necrosis. Now, your risks are never zero, but they drop a lot when you go to see a medical provider, right? When you go to see someone who's been doing this for several years, are they keeping up on their training? Are they board certified? You know, what are those buzzwords that you can look for to make sure that the person you are trusting with your face, with your body, is going to do a good, honest job?
Absolutely. No, that's amazing. What are some of the most common types of treatments you see most patients here at our clinic kind of like urine for? Like, what do you mostly see?
You know, injectable speaking, it's the neurotoxin, that's the filler. With that being said, there's a rise in sort of these anti-aging style treatments and what I call biostimulatories, which I briefly mentioned earlier. So biostimulatories are products that stimulate your own collagen. So that could be something like Radiesse. It could be something like Sculptra. Again, these are brand names, right, for products. But you see a lot of emphasis lately on returning to the natural. I think when filler first came out, it was like big lips, big cheeks, like, and I think you see that in beauty trends in general, right? Yeah. It's this up and down, up and down. Every 10 years, we're looking for the exact opposite thing, right? Of what we did before. Right? Yes, yeah, exactly. So right now, you're seeing a lot of biostimulatory treatments, whether that's inducing your own collagen through injectables or through skin treatments as well. And I think when you think about your general skincare, I like to think about it in 3 ways. 1 is injectables, 2 is skincare that you use on your face at home, and 3 are in-office skin treatments, because they're like this Venn diagram. They all kind of have the same goals. They all do it a little bit differently, and one can't do the other's job, right? Absolutely. So, that's not to say you need to have all these things, but just a way to think about what different aspects may contribute to your goals and your expectations when you come into a consultation.
I've been hearing a lot about Skin Vive.
Yes.
Tell me Sima, please tell me what is Skin Vive.
Okay.
I've been hearing about it so much lately.
Yes, it is new to the United States. Okay. They have been doing it in the UK for quite some time. With Skin Vive, it is an injectable dermal moisturizer. Okay, so hyaluronic acid we kind of talked about, right? Hyaluronic acid is a component that draws in moisture. So that's why you find it in a lot of skincare products. You can apply it topically. If you put it in a gel formation, it can also be injected. That's filler, okay? I like to think about Skin Vive as like the in-between, okay? So it's not going to provide you with volume, but it is going to provide you with hydration and skin smoothing. So it's kind of that perfect in between for filler and for your at-home hyaluronic acid serum is most often what it comes in. So who's that good for? Really anyone. I'm going to be honest with you, right? Sure. I mean, anybody can get Skin Vive, but it is great for mature skin in terms of smoothing over sort of those fine lines. It's also great for young skin. It's also something that can really get you through the Minnesota winter. I know this sounds a little crazy, but it is a treatment that you can inject, and it actually makes you feel more hydrated throughout the winter, right? So it's definitely something that anybody could do, and it is a natural sort of injectable, if that makes sense, right? I do hate talking about like natural injectables because I feel like it all depends on your injector, right? We kind of talked about that education piece and making sure that you're on the same page with your expectations, all of which are important, but there's also an artistry to it, right? So that goes back to looking at the aesthetic of your injector and the aesthetics of their before and afters, right? There is definitely an aesthetic eye that is needed for an injectable treatment. And you see that in sometimes filler that is not so good. Right? Or filler that's obvious, I guess is what I would say. That's what I mean. Filler that's natural, filler that's obvious. I feel like I always joke, if someone says you have good filler, you have bad filler. You're not supposed to talk about it. You can't point it out. Nope.
Just don't. Do you ever just like watch any of these like, reality TV shows, Love Island, like any of those, and like see, because a lot of individuals have filler.
It's so bad. I think there was, what? I know. Do you watch Love Island?
I do.
You do watch Love Island.
Got me on it. I'm not gonna lie. So good.
Okay,
I'm just gonna tell everyone it's juicy. The drama.
It's juicy.
It's juicy. It's entertaining. But do you ever like wow? Okay. Number one, I know each and everything.
Yes.
Every single treatment you've possibly have gotten.
Well, and there's so much they could be doing, right? There's so much out there. And that's the other thing. The world of aesthetics is so intimidating. Like, it's important to find somebody that you can talk with, that you can really, connect with in order to make sure you're getting what you're looking for, because too much filler or injectables sort of, I will say incorrectly placed, can make you look so much older. So it is, I don't think it's Love Island. It is... You know what I'm thinking? It's Full House. Full House is not a reality TV show. It's not Full House. It's not Full House. What is the...
Is it like
Summer House? I think it's Summer House. I think it's Summer House. Are they doing it in Australia?
I don't know. I have no idea.
Okay, maybe they... I think it's Summer House Australia or US, or I have no idea, but it's Summer House somewhere in a summer house. And I saw this TikTok of plastic surgeons guessing how old these people were, and they were guessing like mid 30s, low 40s, and every single person was in their 20s.
Oh my gosh.
So I personally am really excited about this step back of aesthetics into a more natural approach because I'm 31. I have had filler, I have had toxin, I have had skin treatments, and I get so many people who say, oh, I can't tell, or why, you're so young. And it's like, yes, I'd like to stay
Thank you very
Thank
much.
you.
But anyway, here's why.
Exactly.
Absolutely.
So this sort of preventative biostimulatory approach, I feel like, is where we are going. And that's the really exciting thing about, again, this field that bridges aesthetics and science, is that there are these sort of developments. People are talking about PRP, which it is platelet-rich plasma. And it's derived from your own blood that can be injected. It can also be applied topically after skin treatments, and that uses your own body stem cells to speed up the healing process or generate collagen. People are also talking about exosomes right now, which is really exciting. There's just so many more rejuvenating treatments that are coming into the market because that's what people are looking for, because you can tell when it's obvious, because you can tell. And you see it a lot, honestly, in males in the industry. So, for example, I've been keeping an eye on Ryan Gosling lately. Not
what's going on with Ryan?
Not because I don't want to, because I do like keeping an eye on Ryan Gosling, but also because he is starting to get a little bit puffy in his cheeks, and it kind of looks like filler. And you can't. It's all speculation, right? I don't actually know if Ryan Gosling's had anything done, but there's a difference in the way you treat female and male anatomy, right? So that's another sort of checklist. Okay, my injector can tell the difference. There's a difference between the way you treat someone who is Caucasian versus someone who is Hispanic, right? There's a difference in that again goes back to the artistry of your injector and recognizing someone's individual facial features, because I think with this step back into more natural aesthetics, we're also taking a step back from this homogenous approach, as in everybody turns out the same, right? Everybody wants this aesthetic outcome, because it's not true. And when you lose an individual's own beauty, you lose a lot of what makes that person them, right? And aesthetics doesn't have to do that. So I think, back to Ryan Gosling. It almost looks like his face has been treated with filler in a way you would treat a female. So, for example, females tend to have more medial cheek volume, or volume in the center of their cheeks, and that tends to be the widest part of their face. And for men, it tends to be a little bit further out. So men actually tend to be much more flat in their medial cheek, where women tend to have more of that like apple in their cheek. And so a lot of times when you lose volume, for example, throughout the aging process, this fat pad in your cheek starts to drop. You get bone resorption right here, and that contributes to heaviness in different areas of the face. For example, your nasolabial fold, which is this line from the corner of your nose to the corner of your mouth. We get a lot of heaviness here. You also get a little bit of heaviness in your jowls, kind of right under here, and then you get flatness in the cheeks, which can also contribute to a hollowness and unraise. So everything goes down. Everything goes in and down.
Unfortunately, God, dang it, gravity.
Right. And so when you are restoring volume in someone who has ethnic facial features or different facial features, or even, whatever your gender identity is, right? Your facial features need to be treated in a unique approach, and your injector should understand that, as long as they have the right credentials and the right background, and you have sought out someone who matches your ideals.
Wow. No, that's amazing. That's absolutely amazing. How often do you find that, certain cosmetic injections, treatments actually serve more for like medical purposes? So like I want to think back to when I got my Botox, right?
Yes.
One day, I was just talking to Dr. Treen. I'm like, hey, Dr. Treen, I really is there anything that could be done to help with my TMJ? Like I constantly cleanse my jaw. Genuine curiosity. It's not a huge hindrance on my life, but overall mild discomfort and pain. She's like, just pour it on your masseters. Think about it. And she just broke down everything regarding what my masseter muscles do, and just overall the clenching mechanism and how that's affecting my overall joint within my jaw. And like, all right, I want to try Dysport. Like, let me try Dysport, get in my master's, and let's see how it, what happens. And I was amazed by like almost immediate relief. I never would have thought that, I would have temporary relief of just like what I've just been used to for months, even years now, just based off of a simple injection I got in my muscles. So how often do you see that? Do you
all
find
the time.
Really?
All the time. That's such a great question. I feel like I also joke that you can put neurotoxin, Botox, Dysport on anywhere in your body.
Right.
Really anywhere in your body.
Right.
So for your specific example, the masseter muscles, which are kind of back in your jawline, a lot of times they can be overactive and cause teeth clenching. And so when you teeth clench, it hurts. We actually know somebody who's come here who broke mouth guards in their sleep because they were clenching so hard. And, as long as you have gone through your dentist, if there's actual underlying issues, you can inject neurotoxin into these areas and it can actually reduce the muscle activity and soften the clenching. And for people, it can be a game changer,
right?
And even stress headaches sometimes, or tension headaches. A lot of times people sort of make this angry face when they're focusing.
Where do you get that to actually help relieve that?
Yeah. So in between the brows and then the forehead.
Okay.
Yep. And those stop those muscle contractions, which can contribute to reducing the muscle tension.
Wow.
And that's what contributes to that sort of achy feeling, especially, if you do it in your sleep, it's not even something you can consciously fix, right? A lot of times these things are subconscious. They just happen. They're habit and they develop over time. Right. And so it's really nice for people. The other unexpected benefit of toxin is sometimes it can actually make your skin look better. So neurotoxin can reduce the activity of the sebaceous glands or the oil glands in the skin. So a lot of people who get treatments in their forehead, they say my acne's better. I'm breaking out less. My pores are smaller. You can also use it in a way that's called microtox. So tiny little injections to help with rosacea. Wow. You can use it in your platysmal bands, which are these neck band muscles down here. And that can help to reduce pulling on the jawline as well. Wow. You can put it in your chin. You can put it in your lips. You can put it in your nose, really. You can put it around your eyes.
You were not lying. You
can
put it
anywhere. You can put it in your trapezius muscles. Yeah. You can put it in your hands for hyperhidrosis, or your armpits. Hyperhidrosis means excess sweating. So oftentimes it gives relief from that. And that's something that so many people just don't even have an idea that can be done.
Right.
Right. So there are so many applications, whether it is cosmetic or therapeutic, and there's a lot of benefits to exploring injectables if that is an area of interest of yours for something that's not just an aesthetic effect.
Right. No, absolutely. In your opinion, are you pretty for like preventative measures, getting cosmetic injections for just aiding in preventative measures? Do you think it's like a viable and not, should it be coupled obviously with any sort of treatment that you could receive from a provider, or do you think it could honestly act solely on its own and help with certain conditions like just sweating? How long would you need to continue to continually help with that condition?
Good question. Typically your neurotoxin is going to last anywhere from like 3 to 4 months. If you're lucky, it lasts a little longer. If you got a high metabolism, it might be a little bit shorter, right? I would say if it's something that perhaps has a rooted medical issue like hyperhidrosis, I do recommend seeing a medical provider first, just to make sure there's no underlying health issues. Now, for something that's solely aesthetic prevention, something I like to think about is if you are doing it for you. What I mean by that is we get a lot of patients who come in who almost have this like sort of sense of shame around it, or that this aesthetics treatment is related to vanity and that they shouldn't be getting it done, but they want to get it done. And there's this sort of like shame and embarrassment around injectable treatments. And that's a whole nother podcast.
Yeah,
we could talk about that for a while. Yes. But I think as long as you are seeking this treatment for you and not because, it is a standard you feel you have to meet, then absolutely use it as a preventative measure, right? Absolutely. There is no shame. There's nothing vain about taking care of yourself, right? And if that's the way that you find you take care of yourself, great. If you want to grow old with wrinkles on your face, do it, right? We all know growing old is a privilege, and I don't think it has to be this duality between appreciating getting older and defying the aging process. I think that you can have both things simultaneously, and it just depends on what your goals are. So for me personally, yes, Yes.
100%.
You know, and within reason. And I think, like you said, it can be coupled with other treatments too. I think for whatever reason, there's this stigma around injectables that there isn't as much on skincare because injectables have this fake connotation about them. But as we're seeing, you know, we're seeing this step back. So I think it just really depends on your individual goals and your expectations. And the good news is that eventually it all goes away.
Right.
So,
Absolutely.
so if you don't like it, you don't have to keep doing it. Yes.
What are some of like your most favorite injectables? Like what is your go-to? Like
I mean, all of them, because
all of them, please.
They all do something a little different, right? So it's hard to say. I do love filler because I feel like it gives an immediate result, which is really, really nice. I do love that toxin has this therapeutic effect that can be given to a lot of people. I do love treatments that are biostimulatory because I feel like it can create this really harmonious natural effect within your own skin. And also there are so many other targeted injections too. The world of injectables is so huge, right? You have injectables for hair loss. You have injectables for leg veins. You have injectables for so many different aspects that it really is never ending, honestly. So kind of keeping the focus within the neurotoxin and the filler and somewhat of the biostimulatory for the purposes of today. All of them.
That's
why I work here.
It's an acceptable answer. We'll take it.
Yes.
Do you have any like favorite stories? A patient that you like who was super, super conscious of how they were looking and they've just had an absolute transformative journey in terms of their self-esteem, just everything that they've gone through. Do you have anything that kind of stands out to you?
Yes. Actually, you know what's funny is I had thought about this beforehand and I didn't think of this particular story until you just said it. Yeah. So this is real off the cuff. There was a patient who had a really poor relationship with their father. And when this patient looked in the mirror, a lot of their features reminded them of their father. And so it was something that we actually used injectables, and specifically I believe it was like a thinner upper lip, right? Something that wasn't, we're not changing the entire face of someone, you know, this is not plastic surgery, but we had just done a little bit of a non-surgical filler augmentation, and this patient started crying because they didn't have to look in the mirror and see the face of somebody that they didn't trust, didn't have a relationship, didn't want to be in. So I think those stories are often overshadowed. And there are so many, I mean, there's countless stories. I love. That's why I love filler. So maybe that's my favorite injectable. Because patients look and they stand up in the mirror and you can see it. You can see how excited they get by their results. You can see immediately the level of self-confidence that gives someone. And that's why I don't think it's about vanity.
Absolutely.
It's about you taking care of you. It's about you feeling good in your body. And I don't think that you should feel shame for that.
Absolutely. No, that's incredible. I can't imagine how many stories and how many people you've interacted with.
No, and on a funnier note, we did have someone over the pandemic who injected themselves with filler.
Oh no!
And called us to dissolve it, which I have so many questions. Where'd you get that? What is that?
What did you put mayonnaise in your lip or what? Why?
What did you just like stir up a little home chef version of? I don't know. And obviously there is. I mean, we just heard a story not too long ago about black market Botox that was out there, right? Like there are things that you can get, but you know, the real deal is coming from someone with a medical license. Yeah. So just know that, you know,
for sure.
But also it's a miracle you didn't have any complications with that filler. If you injected yourself and you didn't like the aesthetic outcome, maybe you should go to school. Yeah, maybe you should.
I think that's in your alley.
Right. If you're that good naturally, but honestly, it was wild. I think we had a lot of hobbies in the pandemic, and I am thankful that there were not more people that took up that one.
Absolutely. If there's one takeaway you can take away from this podcast today, do not try it yourself.
Don't do your own filler.
Go to someone. Please go to if there's
Yes.
multiple takeaways from this. You've had so much amazing knowledge to give on cosmetics that have just opened my eyes just sitting here. So thank you
You're
so
so
much for your
sweet.
time. One very, very important takeaway: please see a referring provider. Please go to someone that is knowledgeable in this field, that knows your goals, that understands what you want out of this. Have an honest discussion with yourself, a provider, about your goals, your overall outcomes. Make sure that this is something that you want and something that you're prepared to take steps forward into changing. The world of injectables is broad. It's a very, very broad umbrella, as Sima's described to me today. It is an absolute amazing transformative way to become your best self.
And truly, this is just the surface. This is the tip of the iceberg.
Absolutely. If you are anyone out there is interested in more and more of cosmetic injectables, the world of cosmetics, please go ahead and refer to this episode, refer to our website at turindermatology.com. Sima, I want to thank you so much again for being here. For those out there, stay curious, stay inspired. I'm your host, Shiab Adam.